Hi, this is Kip Harry, live at Discovery on Target 2012. I'm here with Jonathan Whetstine, Assistant Professor at Harvard and Mass General Hospital. Jonathan, how are you today?
I'm good. How are you?
Doing all right. How did you enjoy the session?
The session was great. It was nice to catch up with colleagues that I see at various meetings and various places who are here, and they get to see the newer stuff that we have, so it's nice.
You were completely inundated with questions after your talk. Can you tell us a little bit about your findings in Jumanji proteins and disease and some of your attempts to inhibit that?
Yeah, so our work is very much centered on trying to understand how the enzymes are working and their relationships to certain types of cancer. We're not so much dedicated on one type of cancer. We're kind of looking at it from a pan approach. We've been able to collaborate with various institutes and look at a large number of data sets. So one of the things we're interested in doing is identifying variants that will potentially influence diagnostics or potentially influence therapeutics. So being in a crowd of pharmaceutical scientists as well as academic scientists who have an interest in that, it's always great because many of the people have asked questions about the variants or the levels or the cell models are interested from an actual targeting point of view. So it opens up, I think this opens up a new opportunity for us for collaborations or working with various places, industry, for example.
Targeting histone demethylases is relatively new, and so what are the challenges that are you facing recently?
Yeah, so the big question with methylases, demethylases is the specificity. So for example, the family that I talked about, which is the JMJD2 family or the KDM4 family, there are 4 of those members and their catalytic domains are similar. They have slightly difference in substrate specificity. So a lot of it's going to be the chemistry and trying to understand from the crystallography and structure function which residues are most important, and then can you take advantage of making different variations on that. But ultimately, I think that the inhibitor studies have been advancing quite nicely academically and from pharmaceutical science. But the ultimate challenge, and the real challenge for any of them, KMTs, KDMs, is really going to come down to what biological system or what method of readout and what do they really do. So if at the end of the day, the fundamental catch to it all is what is their biology. Yeah. So without biological models or cellular models or in vivo models, really knowing how the compounds or drugs are going to work is still going to rely on that. So I think this from a fundamental bottleneck, that's where it is. So I think it's extremely promising because of mutations and variations. The fact that they are druggable, because now we know they're druggable, and you saw many cases where they showed druggability. But the question is then what biological context? So I think the biology and the depth of biology becomes really fundamental.
I know you're pressed for time because you're off to another meeting, but what are the future prospects for you and your work?
Well, we're really excited about the studies we have because we've been able to identify variants and changes in cancer. We're very interested in this and certain other neurologic disease, which we've started to look at and actually see some suggestions or maybe links there. We're really excited about it, and the long-term plan here is, and this is one of the reasons this meeting is very appropriate, is the goal is not just the biochemistry, the molecular biology, the basic science, but what we really want to do is take that information, integrate it in with diagnostics or integrate it in with therapeutics. And so there we get a more holistic picture. So I think for us, the long term, since we're actually making strides, looking at variants and change and how that relates to disease or cancer, the goal is then to be able to fuse the basic science and translational medicine. And with Mass General behind us and being able to work, be in that environment, the ability potentially to move this to therapeutic application is really tremendous.
Fantastic, and we look forward to some great publications coming up, and thanks for your time.